Dr. Vinay S.Pillai, the flamboyant cornea surgeon from Giridhara Institute, Cochin, in his video demonstrates corneal perforation, tissue adhesive to the rescue.
Corneal perforation or impending perforation of the cornea is an emergency which needs to be tackled immediately. Often, amniotic membrane or corneal tissue necessary for a patch graft in these conditions will not be available in the emergency room. In such situation, tissue adhesive is a good alternative. Tissue adhesives from biological derivatives like the Fibrin Glue is not preferred here due to its low tensile strength. On the other hand, synthetic tissue adhesives or glues as they are commonly called gives good tensile strength and is extremely good at restoring the tectonic stability of the globe. Most common synthetic adhesive used is the Cyanoacrylate Glue. When this glue is applied on the ocular surface, the liquid monomers of the cyanoacrylate rapidly polymerize into solid polymers in the presence of anions. Glue is most commonly applied under topical anesthesia on the slit lamp. If there is corneal perforation, the procedure is performed in the operation theatre. A 56-year-old gentleman with lac of thalamus presented with persistent epithelial defect, corneal melt and descemetocele. The first step in application of the glue is meticulous removal of the loose epithelium and tissue debris. The loose epithelium is scraped off from the edges of the ulcerated area till healthy stromal surface is exposed all around the ulcer. The necrotic stroma is removed from the ulcerated area. The care should be taken not to create a perforation or in case of a perforated cornea, not to enlarge the area of perforation. The surface is then dried to the maximum before glue application. Glue is loaded in a 1 cc syringe and then applied to the ulcerated area. Here, the base of the handle of a PVA sponge is used to apply a very thin, uniform layer of cyanoacrylate glue. It can also be applied with a thin needle or cannula. Care is taken to prevent application of too much of glue. Once the glue solidifies, a bandage contact lens is placed over the glue to avoid conjunctival irritation from the rough surface. Topical medications are then continued. Once the healing is complete, the glue dislodges itself as the epithelialization progresses under the glue, or it may have to be removed usually 2 to 3 months after the application. Disadvantage of cyanoacrylate glue is that it induces inflammation, causes scarring and vascularization of the cornea. But the advantages are many. It is very cheap, technically very simple compared to amniotic membrane grafting or corneal patch graft, and gives excellent tectonic support. Because of these reasons, cyanoacrylate glue has really revolutionized and simplified our management of impending perforations or corneal perforation.